What's up, science lovers? I'm Gori, one of your cafe coordinators, and we're back with the Teen Science Cafe presentation. Before we go further, we'd love if you subscribe to make sure you never miss another awesome NCMNS video. Remember to be respectful in the chat, as our moderators will be keeping an eye on the comment thread. And please leave your questions in the chat. You can check out Teen Science Cafe Raleigh on Twitter, Facebook, and Instagram.
Tonight, we've got an exciting guest for you. Our presenter is Jamal Moss, a third-year medical student at Meharry Medical School in Nashville, Tennessee. His experience as a medical student and frontline worker during the COVID-19 pandemic has made him privy to the pandemic's impact on underrepresented populations. Please welcome Jamal Moss.
Good evening, everyone. I am so happy to be here with y'all tonight, and so happy to talk about my background and also some research that I've conducted while in medical school here down in Meharry. So I will go ahead and share my screen. Presentation. All right, hopefully y'all can see that okay. But we will go ahead and get started. So the title of my talk today is called Pandemic Medicine During the Age of COVID. So just to give you a little overview of what we'll be talking about tonight, first I'll discuss just my upbringing up in Charlotte, North Carolina, then talk about my transition to the research triangle. Then later I will go ahead and dive deep into the research that I conducted at Meharry Medical College. And then we will wrap up with some questions and comments that you all have. So to start us off, I was born and raised in Charlotte, North Carolina with my two younger brothers. As you all can see, I'm not sure if you all remember the challenge a few months ago where you had a kid picture and you try to recreate it. That's what you all see going on right here. But yeah, I graduated from West Charlotte High School and I actually attended Central Piedmont Community College. So just a little more info about me in high school. I was not the best high school student. I honestly did not take going to college seriously until my senior year. And even then, I graduated high school with maybe about a 2.7, 2.8 GPA. So that I say that all just to say that it doesn't matter, how you're performing. You can always start to take the steps to achieve your goal, no matter what your current state is. If it's something that you're passionate about and that you want to do, there is always a way to do it. So my high school was pretty unique in that we actually, they gave students scholarships to attend a community college. And that's what I did. I was able to attend a community college completely free with the scholarship that I got. And I finished up Central Piedmont. I started in 2010 and I got my associate's degree, Associates of Science in 2012. And while I was at Central Piedmont Community College, I did a lot of different things. I was involved in student government. I did a lot of community work. I was a part of some of the honor societies. But one thing that I really appreciated about going to the community college is that there was such a diverse group of people. You had young folks, you had older folks, you have working people, you had people who had just graduated from high school, and it brought a lot of different perspectives that you don't necessarily get on a college campus where everyone is around your age. So if anybody out there is interested or contemplating going to community college and transitioning to a four-year institution, I definitely recommend it, especially if you're not really prepared to go to school or you're still trying to figure out what you want to do. It's a great way to save money. And also gives you some time to think about what you want to do before you get to that four-year institution. But I'm still really connected with Central Piedmont Community College. My little brother, actually one of the ones you saw in the picture, ended up going there and getting his associate's degree as well. I still go down there and visit and try to make sure that I go back and encourage folks to continue their education and transfer to a four-year institution. So after I graduated from Central Piedmont Community College, I decided that I wanted to travel or transfer to NC State. So in 2012, I made a road trip to Raleigh, and it was probably one of the best road trips I ever made. I'm so thankful that I decided to go to NC State. At the time when I was applying, I think I was thinking about State, North Carolina Central, UNC, and there was one more, East Carolina. However, NC State won my heart because of actually their research focus. When I was looking up schools, I was just so elated to hear that students could be involved in research. And at the time, I had never really had any research experience. And just the idea of being able to be in a lab, the idea of being able to be a part of any type of research process made me so excited. And the picture I have there on the right is actually singer Scotty McCreery and Chancellor Woodson. And that was at Packapalooza. I think that was maybe 2013 to 2014. And that normally was the start, how we kicked off our academic year. And it was always so fun. I'm sure you all who are familiar or who live in Raleigh know they shut down the street and just fill it up with great food, great people. And it's such a great event, a great family event as well. So while I was at NC State, I was a part of a lot of different things. And I really enjoyed going to the North Carolina Museum of Natural Sciences. It was a big part of my time at NC State. And it was really one of the things that I do talk about a lot when I tell folks about my time there. But when I got to NC State, I decided that I wanted to major in biological sciences with a concentration in integrative physiology and neurobiology, or we say IPN for short. And as a transfer student, you take most of your basic classes when you're getting your associate's degree. So once you transfer over, you will be taking more of your major classes. And my first semester was a bit of a rough start, honestly. I had to get used to the rigor of the courses, but I also dealt with some medical concerns. I actually had to sit out of classes for a month. But I was able to get past that and bounce back. And I literally got to NC State and hit the ground running. Any opportunity that I got to do research or be a part of the community, I made sure that I sought it. So one of the first things that I did my first year, or the summer after my first year, was I was a part of a biostatistics program up at Columbia University. And I worked with a biostatistician as well as a cardiologist. And we looked at a device called the left ventricular assistant device. And it is used, or a piece of technology that is used for folks who have heart failure. And essentially what this device does is reroute the blood from the left side of your heart to your aorta. And what we wanted to look at was, once we implanted this device, what are the chances that someone will have to be readmitted to the hospital because of some type of complication? That was probably one of the best summers of my life. I got to spend up in New York City, which I highly recommend. If you've never been in New York City in the summertime, it is definitely something you should do. So many free events. I met so many amazing people. The students that I did the program with inspired me so much once I heard their stories and the things that they were doing. And it really made me want to get back to NC State and work even harder, honestly. And that was I think a 12-week program. So once I got back to NC State, again, I hit the ground running. So that next semester, I focused on a lot more biomathematics. So I took a lot of calculus courses, which was really cool. I didn't know that. I knew that I loved math, but I didn't know that I loved it that much until I saw how we could integrate it with biology, which was really cool. So during my second year at NC State, I worked with biomathematicians, and we wanted to, at that time, we were looking at water fleas and we were looking at their reproduction. It was an okay project. It wasn't my favorite, but it was really cool. It was still a really great experience and a great way to network as well. And actually, because of that opportunity, I was able to do a biomathematic research project that next summer, which was even better because I got to work with honeybees. Never in my life would I thought that I would be able to work with honeybees. And for that particular project, we were interested in how honeybees clean themselves. So in the honeybee community, they have different types of honeybees. And there's this thought that these different types of honeybees clean themselves differently, clean their hives differently. And we wanted to see if there was any statistical significance or mathematical significance to that. And what we did, and we started this research from the bottom to the top. So NC State actually does have a bee farm. It's not too far from campus. If you all haven't heard it, it's really cool. But we went out to the bee farm. We had to set up our own hives. And then every morning we had to go out there. We had to collect our bees and we had to run experiments on them. And essentially what we did is we would paint these little dots on the back of the bees so we can know which type of honeybee it was. And then we would dump all this flour on them, right? And we would then record the honeybees cleaning themselves. And we would take this recording and we would put it in a mathematical program called MATLAB. And we would measure how well they clean themselves based on the pixels in that video. So we know that bees, since we covered them in flour, they would start out white, but as they cleaned themselves, right, they would get darker. So the pixels would transition from white to dark. And based on how well that transition would, we can tell how well the bees clean themselves. By the end of the summer, we ended up finding out there really isn't a big difference. However, that was the first time that I was there from the beginning of a project, and we actually had to build the supplies. We had to build the camera setup. We had to make the mathematical code. We actually got to present our research findings at Ohio State that summer, which was really cool. And for me, it helped me realize that I wasn't necessarily interested in biomathematics, but it made me understand the significance of working interdisciplinary, making sure that you have different folks at the table to solve complex problems. So after that year, I actually was able to focus more on the neurobiology, and which was my last year at NC State. And I got to work with some awesome people like Dr. Patasol and Dr. Madsen. And that year, I focused on neuroendocrinology. And what we wanted to see was, how do certain substances, such as maybe a fire retardant or other substances that we find in our home, how does it affect brain development? And we wanted to measure that by exposing lab rats to that chemical and then looking at their offspring and see how they reacted to certain behavioral challenges. And one of those behavioral challenges was putting the mice in a box and seeing, and it's called an open field test. So you put this mouse in a box and you want to see if the mouse would stay in the center or would it more likely go into a corner and stay there. And we would record this. And sadly, I didn't get to finish that project because I graduated, but it was so cool to be able to work with animals. That was my first time working with lab rats. It was kind of freaky at first because some of them had red eyes, and I admit it did freak me out, but it was great exposure. I got to work with some awesome classmates of mine, got to meet a lot of cool people. And it taught me that there are different ways in which we can learn about behavior, as well as it made me realize that environment has a large impact on how we act or how we develop. And that was the first time that I really got exposed to what we also called epigenetics, which is essentially how your body expresses the things that it needs to grow. So how certain proteins are made and things of that nature. And by the end of my first year, or by the end of my last year, I had grown to love the neuro department at NC State so much I didn't want to leave. So I didn't. I actually graduated and I was able to work as a research assistant at NC State with Dr. Patasol, who I sadly don't have pictured here. But some other things that I did at NC State, I was also a College of Science ambassador, which really focused on talking to potential students and their families, answering any questions they have, also helping the college run any programs that they were currently doing. And another great way to network and to meet a lot of great people. I also worked. I come from a low-income family, first-generation college student. So having an income or having money was really important for me. And I was able to balance that. I actually worked at the 24-hour desk over at Wolf Village, which was really cool. And I actually did that as soon as I got to NC State. I started that like December of my first semester, and I stopped that last semester. But it was still a great experience there. And I was also part of a lot of service projects. I love doing MLK Day. That was something that was really big. And just, I really enjoyed my time at NC State. So if there's anyone on here who's definitely considering NC State, please let me know. I can talk about it all day. I definitely wouldn't mind connecting you all to some amazing people over there. I really found my community, especially in the Office of Diversity and Inclusion with Dr. Jamila Simpson. She, man, I can't even express the love that I have for her and that office over there. There were so many times where I would study so hard and I wouldn't get the grade that I want, or I was just overwhelmed with financial burdens or just family problems, and her door was always open. There was one time I wasn't able to go home for Thanksgiving. I got to spend Thanksgiving with her family. Just so many moments and so many people that I include in my tribe and close my close family now that I still talk to today. And I actually got to work with Dr. Simpson a little later on, but I'll get to that after I talk about my experience at Duke. But right after graduating from NC State, I worked as a research assistant briefly with Dr. Patisol. However, a few months after that, I got a job as a clinical research coordinator at Rex Hospital, which is literally right down the street from NC State. And I did that for about 3 years. And in that position, what I did was I helped a team of interventional cardiologists, cardiothoracic surgeons, and vascular surgeons run their research studies. So I would go and talk to patients. Let's say someone came in for a stroke and they needed to get some type of stent in their arteries in their neck, or maybe somebody had a heart attack and needed to get some type of stent in their heart. I would go and talk to them about some type of experimental stent that was going on at the time. I would do all the paperwork, do all the data entry, and make sure that we were collecting the correct information for that research study. And that was my first time working in a hospital environment. That was my first time working with a group of doctors. And man, I worked hard. That was probably one of the hardest working times of my life. But it was really satisfying because I got to see firsthand how medicine and even science can change lives. There are people who, because of maybe certain insurance reasons or maybe some other health complications, they couldn't go directly to certain treatment options. However, through a research study, they were able to get some form of help. And that was really helpful. And one other thing that really came, or that really became really important for me during that time was the topic of ethics and bioethics. When you're talking about research studies and clinical studies, you have to make sure that folks are getting informed consent so they know all of the risk and benefits of a study, as well as alternatives to this research study. So they don't necessarily have to go this route, they can do something else, but you have to let people know all of their options. And as I started to dive deeper into clinical research, I started having more questions about ethics in general, not just particularly with clinical research, but also just in medicine and public health. So for that reason, in 2017, I decided that I wanted to enroll at Duke University in their bioethics and science policy program. Now, I know as an NC State graduate, we don't really get down with Duke or UNC. However, I thought that this was a great opportunity to learn more about how I can make a broader impact in medicine and even in science. And I think this is also another great talking point in that when we talk about science, we often think that, oh, you have to go work in some type of research lab or you have to go work in biotechnology. But actually, we need folks who understand science and who are interested in policy. We need people who are able to translate what's going on in the lab into some type of recommendation that affects people on a daily basis. And that's essentially what science policy is and bioethics. And my concentration was public health ethics. And at the time, I was interested in how racial inequities affect the health outcomes of underrepresented groups within the Durham population. So while I was at Duke, this was a one-year program. So from 2017 to 2018, in my research project that summer, I worked with a nonprofit called Talk Health with Frankie. And as you all can see, that's the picture on the bottom right. And me and my classmates in that top picture. But I worked with them by implementing a health coaching program and a family medicine practice. And we wanted to see if this health coaching program could change health outcomes. So just to give you all a little bit of background about health coaching, essentially what it is you have someone there who is there to help you reach your health goals. So let's say you have a patient who is diabetic. and they're interested in changing their diet. You don't necessarily have to immediately start medications for diabetes if it's depending on certain criteria. So there are certain lifestyle changes that you can make. And we found that folks who have someone who they can talk to, who's understanding and who can point them to resources, actually have better outcomes. And that was another great summer because I got to explore Durham more. I got to learn more about actually Durham is called the City of Medicine, which I learned when I got there, but I got to learn more about how Durham has played a big role in developing public health policies and science policy as well. So during my time at Duke, I again hit the ground running, did a lot of different things. And one of the things that is really near and dear to my heart is that right after my first year, so the summer, right after I finished my research project, so in 2018, I felt actually really powerless. I had just learned about the history of Durham. I learned about how Black and Brown communities in the past were treated. I looked at how policies affected how communities were built. I was discovering that housing policies were destroying communities, such as the Haiti community down there. If you all have heard of that, how highways were used to separate those communities and destroy them. And at the time, I was like, man, there are just so many problems. I don't know what to do. And a friend of mine actually forwarded an opportunity to me. And I want to take this opportunity to also say that it is so important that you all stay connected to your community. All of the opportunities that I'm talking about have come through people. The job that I got at NC State as a research assistant, I got through my research mentor. The job that I got at Rex Hospital, I got through NC State alumni, right? The racial equity task force opportunity I got from a friend, they told me about it. So I applied and I was able to get appointed to be the chair of the Environmental Justice and Health Subcommittee. And in that role, essentially what we did was talk to community members and talk to other relevant stakeholders in the community, such as organizations, health groups, to learn about what did they think needed to change in order to eradicate structural and institutional racism in Durham. The mayor was really supportive of this. We wanted to get this rolling. And this was a way that I thought that I could make a big impact in Durham. So over that year, I worked closely with that group. And actually in 2020, we released those recommendations, if y'all are familiar with that. But that was just some awesome work I did there. That same year, I also continued to work with Talk Health with Frankie, and I actually got to expand my role there. I was their health equity and policy specialist, and we got to do so many cool projects. We did programs called Zumba Meets Trap Yoga, which we partnered up with a yoga instructor. And trap yoga is essentially you're doing yoga, but you're listening to hip hop or you're listening to the top hits. And then we paired it with Zumba. It was so much fun. We always had a packed house. We would also do things such as taking visits to community gardens. So we would take a group of patients that were a part of the health coaching program, and we went to the community garden out there in Durham, and we would pick fresh veggies, and then we would actually go to their on-site kitchen and cook stuff. It was so dope. One of the coolest things I've ever done. And definitely recommend visiting some of those really cool community resources if you have a chance. And then actually I finished the Duke program in December 2018. And by the time I got finished with that, I decided that I wanted to go to medical school. So to rewind back just a little bit, before I graduated high school, I had decided that I wanted to be a vet. But by the time I graduated from high school, I was like, you know what? I think I would much rather work with humans. Animals are dope. I loved it, but it just seemed really challenging. And I also started to get more invested in medicine, and I was starting to read more books about it. However, by the time I had graduated from NC State, I was like, do I want to do medicine? There were just so many cool other biotech opportunities that I could do. However, after doing a lot of biotech stuff, after working in clinical research and after working with Talk Health with Frankie organization, I realized that medicine was my calling. So for that reason, I applied to Meharry Medical College and I matriculated into in 2019, that summer, for their class of 2023. And it's a picture of me and my classmates. We actually took this picture last February for Black History Month. And I can say that this was probably one of the best decisions that I've ever made in my life. This is honestly the only time that I, or probably anyone else, will see this amount of Black doctors in one location in their lifetime. Going through medical school is extremely tough. And also going through any type of education, whether that be undergrad or graduate school. And what I always recommend to students is anytime you get somewhere new, you have to build your community. Find people who support you, find people who love you authentically, and find people who allow you to be yourself unapologetically. That's so important. And I definitely felt like I found that at Meharry, just like I also found that at NC State with Dr. Simpson and Dr. Pattisall. And I also found that at Duke, but not to that extent, just because I was only there for 1 year. But once I got to Meharry, it was awesome down here in Nashville. I do have family in Nashville. This was my first time actually living here. And getting used to medical school was definitely tough. There's a saying that the information is coming at you like a water hose. Definitely so. It was a lot of information at one time. However, you just have to learn how your study schedule works. And that's going to be across any type of education you're getting. You have to find the things that work for you. However, started medical school the summer of 2019. And then, as you all know, by January 2020, the first confirmed case of COVID happened, right? And at the time, right, it wasn't really a big deal. We kind of heard about it. People weren't really freaking out yet. However, by March, things had shut down completely. That's when we saw stay-at-home orders implemented, mask mandates were implemented, and campuses were shutting down. And for us as medical students, that was extremely difficult because, right, to be a medical student, that's hands-on experience. I have to know how to listen to someone's heart. I have to know how to do an abdominal exam. I have to know how to check someone's cranial nerves, right? And it's really hard to do that if I can't put hands on people. So that was a big transition for everyone. And also at the time, due to just all of the news that was coming out, I had really, really bad anxiety. And it was a moment in time where I'm sure, just like the rest of the world, we were trying to figure out what we can do to help, especially as medical students. But by the summer, that's when community-wide COVID testing was available. And that was an opportunity for not only myself, but my classmates. Also, dental students at Meharry and graduate students were able to be on the front lines. So that summer, me and my classmates and Meharry Medical College, we actually were in charge of multiple community COVID testing sites throughout Nashville. And this was some hard work, y'all. As you all know, in the South here, it gets hot and you had to have on all this gear. And these testing sites were in these large parking lots. And it was extremely hot. You're surrounded by cars. We were testing thousands of people a day. At one site, we would test over 700 people in one day, y'all, one day. A lot of hard work. People, and these were volunteers. You know, there were doctors down there. However, they weren't getting paid for that. They were volunteering their time. And this just speaks to the conversation now about burnout. You know, we've been doing this, medical professionals, the medical field, public health field has been going 2 to 3 years with fighting with this. And a lot of folks have volunteered their time to do this. So that's just something that we definitely want to keep in mind as we talk about this. But we were extremely happy to do what we could and to make sure that people were being safe. However, during that summer, though, medical students, first-year medical students are required to do a research project. And at the time, around January, when things were first starting to develop, I thought I was going to be, you know, maybe New York City or LA or Washington, DC doing some amazing research. However, all of that got squashed. So by March, April, all of my classmates, we were scrambling like, what are we going to do? What are we going to do? Everything's canceled. We still have to do a research project. But one really cool thing that my school did was they started a program specifically for pandemic medicine. And what this allows students to do is we got to study how COVID-19 affected our communities. And the project that myself and a few of my classmates wanted to look at was how is COVID-19 affecting the African American community? And at the time, we were learning that folks of color, particularly Black and brown folks, were overrepresented in hospitalizations as well as COVID deaths. So African Americans are almost 3 times more likely to be hospitalized and 2 times more likely to die than white folks. And that was really alarming because we already know that there are inequities that allow or that don't allow folks, Black and brown folks, to get adequate health care or to even just to get resources. So we were really concerned about that and we wanted to know how that affected them. During the time, we also learned about how wearing masks were affecting African Americans because we knew that African Americans were more likely to report that mask-related social identity threats from public and police compared to whites, leading to police avoidance or decreased face mask use in the early pandemic. That was alarming because we know that face mask was a great preventive tool to make sure that the virus was spreading. However, if I think that I'm going to get harassed by the police or potentially seen as some type of threat, I'm not either one going to go out in public or I'm not going to wear a mask, right? Another thing that we also noticed is that we were concerned that folks didn't really understand what social distancing was. There were a lot of conversation about what it really meant and the definition, and there were a lot of different voices in the room. So we were just concerned about that. And the last thing we knew is that African Americans and Latinos made up a large portion of the essential workers. And this is also another great talking point to say that at that time, or even before COVID started, right, we never saw folks who worked in the grocery stores as essential workers. We didn't really consider teachers essential workers, right? But as soon as the pandemic started, right, we realized that, man, you don't have nobody running the grocery store, we got a problem. Or if you don't have anyone teaching students, we also have a problem. So we wanted to know how Black and brown folks, how Black folks who are on the front lines as essential workers, how are they doing? There was a lot of information then also about companies not giving their employees adequate resources, right? Not supplying them with masks or making them work in confined spaces, right? Making it harder to prevent the spread of the virus. So with all of that said, myself and 2 other classmates teamed up with a public health researcher, 2 public health researchers and a biomedical researcher. And we decided that we wanted to reach out to the African American community. And we wanted to do this, and we wanted to talk about their specific behaviors. So we wanted to, 1, talk about their mental health. 2, we wanted to talk about were they actually engaging in mask use and social distancing? Were they actually going to get COVID testing? And did they know what contact tracing was? Because that was also a really big thing at that time. And we were also really interested in, would African Americans be interested in being involved in research? Because at the time they were developing the COVID vaccine. And we did all of this with a specific public health model in mind, and that is the health belief model. And the reason we wanted to use this health belief model is because what this model does, it allows us to understand why folks do the things they do. And this model was created back in the 1950s by the US Public Health Service, again, to understand the factors that influence participation in preventive behaviors. So there are different aspects of this model, one of them being perceived susceptibility. So what are the odds that I think that I'm going to get COVID-19? And if I do get it, how bad do I think it's going to be? That's what susceptibility is. Perceived severity. Again, if I got it, do I think I'm going to have mild symptoms, or do I think that I could have severe symptoms and be hospitalized? We also wanted to think about what are some of the benefits, what are the benefits of wearing a face mask or physical distancing? Or what are some of those barriers? We know that those things don't come easy, especially getting face masks at the time. Folks were having a hard time doing that, or just even social distancing, especially if you live in a multi-generational household. You have maybe 5 or 6 people there. If one person gets COVID-19, it's really hard to social distance if you have to share a room with someone. Another aspect of the model is called cues to action. So what is something that can be done or that is happening that allows people or prompts people to get ready? What is going to make you be like, you know what, I'm ready to start doing these things? And then the last thing is self-efficacy, meaning I have the power to, if I'm able to do these preventive behaviors, do I think I can do them effectively? Do I think I have the tools and resources I need to do them effectively? So we wanted to take all of these things into perspective when we're talking to folks, because it allows us to better understand why they're doing the things they're doing, why they are wearing the face mask, or why they're not wearing the face mask. And by doing so, we can make better recommendations for public health. So for our method, we decided that we wanted to interview about 62 individuals. And we actually did that through Zoom, again, because everything was virtual at the time. And this was really interesting because this was my first time doing quantitative research, and I'll discuss that in a second. And I was just really used to doing bench research based on my time at NC State, where I was in the lab, doing doing piping, pipetting, or working with lab animals. Or when I was at Duke, I was more so in the community, out with folks, talking to people in that way. This was a little different because I'm sitting one-on-one with people and I'm asking them questions. And these were some really intense interviews. We originally had scheduled them to be about 30 to 45 minutes, but most of the time they went up to an hour, just because you realize that people have so much to say. People didn't realize how stressed out they were. They didn't realize that, they were like, yeah, I actually have been spending a lot more time in my room, or yeah, I actually do think I'm a little more depressed than I thought I was. And we wanted to kind of take advantage of that because we wanted to make sure that we were getting good quality information. So just to go back to the qualitative conversation, I do want to engage the crowd at this point, so please chime in if you all know, but I would love to hear if anyone can tell me the difference between qualitative research and quantitative research. And feel free to turn your mics on or also drop it in the chat. And I'll give it a few more seconds. All right, no worries. So qualitative research is we are more concerned about stories. We are things that can't be counted, essentially. So, or things that can be categorized. So such as, what's your favorite color? Red, blue, green, as opposed to what's your age? 6. Or on a scale from 0 to 10, how stressed out are you? I'm at a level 10. That's more so quantitative because we can use numbers, we can measure those, whereas I can't measure someone's favorite color, right? So that's what this whole project was about. It was about qualitative research. It was about collecting stories and finding out how we can gather information from firsthand experience and transform it into research and data that is useful for making any type of public health recommendation. So we did this essentially by, again, interviewing folks. And after we interviewed them, we would then go through the interview or go through the transcript and see if we can find any common patterns or themes throughout those interviews. So while we wanted to talk to the general African-American population, we actually wanted to talk to subgroups as well. And we picked these 4 groups: essential workers, underlying medical conditions, young adults aged 18 through 30, and parents. And the reason why we wanted to talk to these folks is, one, parents, we understood that schools were closing down at this time. We were hearing a lot of stories about parents having a tough time, parents having a tough time helping their students or their kids transition from in-person learning to virtual learning. So we wanted to talk to them. We also wanted to just talk to young adults because at the beginning of the pandemic, or more so around the February or March in 2020, there was a lot of conversation about young adults not being affected by COVID-19, right? At that time, we were seeing older folks and folks with chronic conditions being affected heavily. So we wanted to hear from them. Of course, we wanted to hear from folks with underlying medical conditions because we know that they are more at risk for having severe symptoms or even dying from COVID-19. And of course, we had to talk to our essential workers because we know that they made up a big bulk of the workforce. We know that African Americans were out there on the front lines, and we wanted to see how they were being affected during this time. So to give you all a little timeline about the project, we made this project proposal back in May of 2020, and that's when we assembled the research team. So myself, 2 of my classmates, and 3, we call them our research mentors, 3 research mentors. And by June, we started doing our participant recruitment and interviews. And one way we recruited folks is we had to reach back into our own networks. So again, those community groups that I was heavily involved in North Carolina and in Tennessee, I wanted to reach out to them to see if anybody was interested in doing research, and also using resources that our research mentors had as well. So that was really interesting. It was tougher than I thought it would be. Even though we weren't doing any research that was invasive, right? We weren't asking folks to donate any bodily products. We weren't asking them to put themselves in harm's way. You're still asking people to take time out of their day. And these are people, again, with children, who are trying to balance work and do virtual learning or at work all day. And also being a medical student, I was trying to do virtual interviews in between classes. So one minute I'm sitting here typing notes, the next minute I'm trying to log on so I can hurry up and send an interview. But it was definitely a great experience that I really did enjoy, and I learned a lot from. And I got to use a lot of the skills that I got from medicine, actually, from being in medical school, knowing how to ask the appropriate questions, knowing how to ask follow-up questions so you can elicit more information. That's really important because, again, you want to make sure that you're getting quality information so we can make sure that when we're making these recommendations, that is based on real life experiences, folks' lived experience. By September of 2020, most of those interviews were completed, and we started doing the data analysis. And this was the most daunting task of it all, y'all. Man, could you imagine trying to read through 62 interviews, right? They were about an hour long, and you had to read through every transcript and essentially try to label. Again, we were looking for these themes, right? Common themes or common patterns that we saw. So that took an extremely long time. Again, also being a medical student, trying to make sure your grades are good, but also trying to make sure you're keeping a good timeline for the research project. But by February 2021, we were able to get through the information. We had categorized everything. We had a pretty good understanding of folks were saying about preventive behaviors, about face mask use, social distancing, contact tracing, and COVID testing. And by that time, we started drafting our manuscript or our papers. So although I did do a lot of research at NC State, this was the first time that I got to start a research project from the beginning and stay there until the end. So also creating the paper. This was probably also one of the hardest parts. Writing has always been something that I was insecure about. When I was in high school and once I graduated or once I got to CPCC, I had to take a lot of English courses and my writing got a little better, but writing research papers is a lot different. The language is different. And again, I was also new to the world of qualitative research. So I had to learn their language. So that took a lot of reading articles, talking to my research mentors, listening to other folks within the community, trying to find out exactly how to make sure that all of this information that we got from the interviews was properly being described in those papers, right? We wanted to make sure that we were using the right quotes. We wanted to make sure that we were describing people's lived experience accurately. That was the most important part, right? People were very vulnerable with us, and we wanted to make sure that we weren't doing them an injustice by describing their story incorrectly. So that was really important to us. And honestly, we are still working on that. The manuscript drafting doesn't stop. We're still trying to get the paper published. And one thing that I learned is that it's going to be a lot of rewrites. That's one thing about research. Be ready to do some rewrites. And that's just a part of it. But you grow and you learn and you get better at it. Now, I talked to my research mentor the other day, and she was like, yeah, I can throw out a paper in about a day or two, just as long as I don't have to do the data analysis. But when it comes to writing, I could knock that out. And I'm like, I pray that I get to that level one day. But these are some of the demographic information from some of our participants. So a large majority of our participants were women, about 70%, with only 30% being male. 65% of our participants had associate's degrees or higher. That was really surprising to me. And when we looked at our income, it really ranged. There wasn't a majority of either. Some of them, a good portion were below 40,000, and a small portion also were over 80,000. So I think we did a pretty good job of getting a range of incomes there. So I want to discuss some of the themes that we found throughout our paper. So again, these themes are common patterns that we're seeing that people continue to discuss. So the first one being, how do you define a preventive behavior? How were folks defining wearing a face mask or social distancing, right? Some people were saying, oh, in order to wear a face mask, that includes wearing it to the point where it covers your nose and also covers your mouth, or how you shouldn't wear it. Your mask should not be below your chin or it should not be below your nose, right? In terms of social distancing or physical distancing, a lot of folks were saying, oh, that means it should be 6 feet or it should be more than 6 feet. So we wanted to make sure how were folks defining these behaviors so we could see where their level of understanding was. The next thing that we saw was experience with preventive behaviors. So that was, what was your firsthand experience like on your day-to-day? How was it wearing a mask in public? How was it trying to physical distance, not only at work or just maybe with your family or maybe even people in your household? The third theme was perceived susceptibility to disease or threat. So again, asking people, what do you think your risk is of getting COVID-19? Are you afraid? Do you think that if you do get it, something bad is going to happen? Do you think you're going to be hospitalized? Or do you think it'll be a common cold and you'll get over it pretty fast? Our fourth theme was motivators to participate in preventive behaviors. So what are some of the things that inspired you to wear a mask? Was it you wanted to protect your family? Was it that you just wanted to protect yourself? Or, I just don't know enough about COVID-19. I want to make sure that I protect myself from it. Our fifth theme was barriers to participate. So similar to motivators, what are some hurdles that you face, such as I wasn't able to find face masks. They were all sold out. Or, I didn't know which type of face mask to use. I have a cloth one. I have a surgical mask. Which one is better? Or a barrier to social distancing. I live in the house with 6 folks. Or my grandmother or my mother is elderly. I have to go over and see them. So it's hard for me to physical distance. And our last theme is strategies to increase participation. So we asked folks, what is something that can be done that you think will get people to buy into wearing more face masks or doing more physical distancing? So again, these are the 6 things that we saw throughout all of our interviews, and we wanted to make sure that we categorize the quotes that we were getting from folks so we could understand the story here, essentially, right? We were collecting stories. All of this tells a story. You know, how you view something, how it is affecting you, what were some of those hurdles, and what do you want to see done in order to increase those behaviors? So I wish that I could share all of the interviews with you all, but that's overwhelming, of course. So I decided to pull a few of them out just so you all can see. And I just want to stick on the slide for a second and just review some of those quotes with you all. So just to kind of give you all a layout here, in each quadrant, you'll see a specific preventive behavior. So contact tracing, COVID-19 testing, face mask use, and social distancing. And then for each of those preventive behaviors, each theme will correlate to a particular quote from a participant. So let's start with contact tracing. When we asked folks to define contact tracing, one person said, there's tracing, like when people do test positive, tracing where people have been and who they've interacted with, right? That's one way to define it. And at the time, we noticed a lot of people didn't know what contact tracing was. There was a lot of misinformation out there about contact tracing. People thought that they were going to collect all of their information. They were concerned, like, you know, once you collect this information, what are you going to do with it? People were really concerned with the ethics of it. Are you going to sell my information? Are you going to use it to steal it and maybe steal my identity? People were really weary about it. We saw that there were some people who definitely saw the benefit of it, but there were a lot of people who really couldn't understand or grapple with the idea of contact tracing. So let's move on to COVID-19 testing. So one of the strategies, and I know that this is a short quote, but they said, I need to do them a different type. So I can give you a little more context for that. Of course, when, you know, we first started doing COVID-19 testing, they had to do the nose swabs. And there were a lot of folks who are very uncomfortable with the nose swabs, essentially, especially because they had to go in pretty deep. I'm sure you all remember those nose swabs were extremely uncomfortable. And people just didn't really understand why we needed to do it that way. They thought maybe we can do it a different way. Can we, you know, do an oral swab? Can we do a blood test? But that's a recommendation or a type of strategy that people would like to see. Maybe if we offered some type of other form of testing, maybe people would be more willing to participate in COVID testing more. So let's hop on over to face mask use. Let's look at a barrier. So one of the quotes was, they don't like it around their nose, they can't breathe. So to give you a little context about that again is, we asked folks, what is a reason why you think someone wouldn't wear a mask? And there were a few folks who said, hey, I have an underlying medical condition, maybe COPD, so some type of chronic lung disease, or maybe I'm claustrophobic or I have really bad allergies where it's hard for me to breathe sometimes. Not saying that I'm opposed to wearing it, but I just don't like wearing it for long times. So that is one barrier that you do have to think about, right? We're all not the same. We don't all have the same lived experience. We don't all have the same medical background. So those are just different things that you have to think about when you're implementing any type of public health recommendation, is that how will this different communities? And then let's jump over to social distancing. So let's look at views. So one being, I'm limiting my interactions with people outside of my household. And if there are interactions, just being smart about it. So again, we asked them, you know, hey, how do you feel about social distancing? What do you think about it? And again, there were some folks who, again, were extremely on board for social distancing or physical distancing. They understood that in order to prevent the virus from spreading, there needs to be some form of distance between us, because we know that the virus is spread through oral or some type of nasal passage, right? Those bodily fluids. And by keeping that distance, we can prevent the spread of those fluids. However, those views weren't always the same. Sometimes they changed based on the group that we talked to. There were a lot of young folks, or excuse me, a lot of young people who stated that, hey, yeah, I social distance in some, but when it comes to my friends, I don't really social distance that much, or even face masks. When I'm around my friends, I don't really like wearing face masks. However, that was completely different from folks who had underlying medical conditions, where we heard a lot of, I've been wearing a face mask for a long time now because I have to think about these issues on a daily basis, long before COVID came. In terms of parents, it was more so like, no, we definitely have to wear face masks and social distancing because I can't afford for my child to get sick because I can't get sick. I can't take off of work. So there are a lot of different aspects that we have to think about within these different groups. And I could honestly go on and talk about some of these quotes for a long time. There was so much rich information, but I would also love to take this time to hear from you all, to just hear about maybe your experience with either COVID-19 testing. If you can think back to 2020 when things first started, if anyone would love to share their experience when they first got COVID-19 testing, how they thought it was, I would love to hear if anyone would like to share that. And I can even start off with myself. I remember the first time that I got tested. Our school requires students to get tested on a regular basis. And I was pretty nervous about it, honestly. But at the same time, I knew that it's something that had to get done. And, you hear so many things like, oh, this is going to be painful. It's going to be extremely uncomfortable. So I was extremely anxious and tight when I got it done. But as soon as it was done, I was like, oh, that wasn't that bad. However, that was my experience. I also had to do a lot of COVID testing on babies. That was really hard. Imagine trying to swab a 9-month-old child, parents having to hold them down, restrain them. It was really tough. So everyone's experience is a little bit different. But I would love to hear from you all if anyone would like to share.
I'm so sorry, Jamal, but we really have to get to questions right now.
Okay, no problem.
So the floor is now open for questions, and you can either put them in the chat or at us on our social media account. The first question is, what was the process of transferring from a community college to university like?
It was tough. More so because I was in a new environment, and I didn't have anybody there. I went from Charlotte to Raleigh. However, once I started meeting people, I started getting comfortable. It was definitely a lot easier. But it's definitely something that I would recommend, nothing that I was shy from, but it was a tough transition, but anybody can do it. As long as you have a good support system, you can definitely be successful.
The next question is, were there any incentives for the folks participating in the survey?
Yes, so everyone who participated in the research study got a $50 gift certificate.
The next one is, did you find people ever actually having physical issues breathing with a mask?
Yeah, there were a lot of folks who were concerned, again, having some type of medical condition or just claustrophobic, who had issues. There weren't a lot of people. It was more so just, I don't like it because it's just uncomfortable. But there were a few folks who said that they couldn't do it for long periods of time just because of some medical concern.
The last question is, do you think it would be reasonable for people to distance/mask in the same household?
That's tough. Again, if you're living in a household with 5 or 6 people, that's hard. So even one example, I had one participant who was a mom. She got extremely sick and she said it was hard. Her sons were helping her and they had to wear a face mask and they couldn't really interact with her. They had to pass her meals underneath the door. So it can be tough. That can be something that's really hard to do. especially if you're living in a house with a lot of people. However, it's really easy to wear a face mask. That is something that you can do. The physical distancing part is definitely a lot tougher.
Awesome. Thanks again, Jamal, and thank you all for watching. I hope you were amazed by everything you learned today. We would also like to thank the museum's digital media team for helping us put on the cafe. Don't forget to follow the Teen Science Cafe and mention us on Twitter, Facebook, and tag us on Instagram. Check out the QR code on the screen or use the link in chat to complete our survey. The survey will also be sent out in a follow-up email that you registered with. Completing the survey enters you into a drawing for a $10 e-gift card of your choice to Amazon or Starbucks. Be sure to complete the registration form and tune in for next month's cafe on Friday, March 4th at 6 p.m., where for the first time ever, we'll be hearing from two speakers, Katie Hollinger and Morgan Bell, from the NC State University's Marine, Earth, and Atmospheric Science Department.
Thanks for joining tonight's Teen Science Cafe. If you haven't already, smash that subscribe button, hit the like button, or the bell notification button to make sure you don't miss more premium content from the North Carolina Museum of Natural Science. Don't forget about filling out the cafe survey because your feedback matters, and you'll be entered into the gift card drawing. My name is Kat, and these have been your cafe coordinators. Stay safe and have a fun February. We can't wait to see you next month, scientists.